Okay, my name is James Park, and we are here to do a thorax and lung exam. My patient LP here. Would you mind if we took an exam of you and put it on public viewing for YouTube?
Agreed.
Okay, great. So the first thing we're going to do is we're going to visually inspect the chest. We're looking for any breathing pattern, abnormalities, distress. Make sure everything's moving normally and properly, just like it should be. Not using any accessory muscles, and we don't see any of that. So next thing we're going to do is check the A to P dimension of the chest. So what we want to look at is, you can use this. You can really use your hands if you want to, but the patient is going to raise up their arm, and you're going to check the A to P diameter right here. So it's basically one of these cards, and then I'll do it from this side. But you're going to have it, it's going to basically be doubled. So 0.8%, but basically it's 1 to 2. Otherwise, you got some kind of other issue going on, maybe emphysema or COPD, some kind of thing like that. We're also going to inspect the nails, look for clubbing, any nail abnormalities, really. And then you can also check the capillary refill when you press on the nail and then release. You're going to check for capillary refill. It should be basically in 3 seconds or less. You want it to come back. And we would check all those nails, right and left. Okay. All right. And then you're going to palpate the chest and look for any costosternal, manubrial, or costochondral tenderness or pain, which we don't have. And then basically go all the way down towards to the diaphragm. Auscultation. We're going to auscultate next, and we're doing lung sounds, of course. So we're going to start off with the diaphragm. We're going to go in a ladder pattern, and then we're going to do the same thing, same pattern in with the bell. So start here. And you want to start at the apexes of the lung. So basically right here. You want to make sure you get the top of that. And it's going to be the same over here. Here. And then, like I said, we do the same thing with the bell. Start up here. Here. Okay, anyways, basically go all the way down that way. Next, you're going to percuss. So you're going to use your fingers here. And you want resonance. So it should be resonant all the way throughout. And then you're going to come down. Same thing. Still should be resonant until you get onto the patient's right side. When you hit the liver, of course, it's going to be dull. Or if you're getting down into the diaphragm. Okay? So that's the bottom line on the anterior portion of the chest exam. So I'm going to have you actually swing around and go on the other side now. So now we're going to do the posterior. Same thing. Start off, we're going to auscultate in the ladder pattern, starting at the top again. And we're going to use the diaphragm and the bell. So you're going to have this. Listen to the patient's breath sounds. Here, 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 and here. So all those points, and then you're going to do it again On this one, you're going to flip it over and use the bell, and you're going to do the same thing all the way down in the ladder pattern. So that's basically your auscultation. You're going to percuss, same thing. Just as we did on the anterior side. Again, you want resonance. If there's any fluid, you're going to hit a dull spot. But you want resonance all the way through the lung fields, all lobes. Okay? So that's your expected findings right there. The next thing we're going to do is we're going to look for the diaphragmatic excursion. And that is when the patient, that's basically the movement and how far the movement of the diaphragm should be. Typically, it's going to be about 5 to 6 centimeters. But to do that, you're going to have the patient take a deep breath in and hold it. And so the patient will take it in and hold it. And you're going to find, so right there it gets dull. Okay, you can relax and breathe. And so you're going to basically draw a line. And that would be right here. Okay. And then you're going to have the patient take a deep breath in and then blow it out and leave it blown out. You're going to come again from this area and find right there. Okay, you can breathe again. Breathe again. Okay, so when the diaphragm goes down, of course, that's inhalation. That's going to be the bottom. And then when the patient gets rid of the breath, expires. Not expires. What was the word I'm looking for? Inhalation. Exhalation, excuse me. Exhales. Then you're going to have the difference right there. And that's the movement of the diaphragm. That's going to be 5 to 6 centimeters. Of course, you're going to do that on both sides. So you're going to have them do it over on here and over on here. And that's what you're looking for. And then you're going to do breath, lung expansion. And so what you're going to do is you're going to go basically to this spinous process and come out a little bit. And then you're going to take basically a skin texture up and have the patient breathe in deep and blow it out. And go again, breathe in deep and go out. Okay, and so that's what you're looking for. That chest expansion is really what you want to look for. Okay, so you're gonna do transmitted voice sounds. So like bronchophony. You're gonna take your stethoscope here, and I'm gonna tell the patient to say 99 every time I touch the chest or the stethoscope on her back, and it looks something like this. So just go ahead and say 99. 99. Say it again. 99. Again. 99. Keep going. 99. Again. 99. One more. 99. Okay. So normal finding of that, you're going to have a muffled sound. However, if there's fluid or basically if there's fluid in there, you're going to hear it clear. So the consolidation, that's what I'm looking for. That's what I'm looking for. If there's any consolidation in there, it's going to say 99 clear. So that's basically what you're looking for. Okay. And I believe that's it for the lung exam. Thank you. I think that's it.